All right, we are back on track. All right, we had a technical snafu. My internet went down, so we're doing this an hour later. So I want to thank you for joining me today. Let me know what you think about this hour later time. It's at 8 p.m. So I want to thank you guys for joining me today. My name is Dr. Islam. Yes, I am your poop guru. My passion is to give you guys the best tips and tricks to help out with your gut health. If you haven't already, smash that like button, like, share, and subscribe. And if you haven't already, let me know if you're watching this live or on the replay as well. All right, so let me know if you guys can see the audio and see the video. We have a new system that I'm trying today, so I want to make sure this works out okay. I want to thank you guys for watching me today, and I hope you guys are having a great day as well. We have a great show for today's Poop Tip Tuesday. We're going to talk about the best way to control or to cleanse your colon. We'll discuss different magnesium options and what I recommend, and we'll also discuss why you may have burning when you have diarrhea down below and what you can do to get that taken care of, and your questions live as well. So if you're joining me for the first time, my name is Dr. Islam, and every Monday I go live, typically at 7 o'clock Central Standard Time, to answer your questions. Let me know in the comments if you have a question for me. Also, let me know in the comments if you're watching this live or in the replay. And smash that like button, because the more smashes and likes that we get, the more, the more happier I get as well. Hope you guys had a great weekend. We had a great weekend. My football team, the Longhorns, they won. I'm so excited. This weekend is going to be a big weekend for us. We're playing OU. So let's see how this goes. Hopefully it won't be a slaughtering. I don't know. I'm always nervous whenever UT football plays. And also the Cowboys and the Houstons won as well. Man, what a great football weekend. Hope you guys are enjoying this as well. All right. So topic number 1. Hey, Dr. Islam, what is the best way to cleanse my colon? All right, let me know in the comments down below if you've seen colon cleanses out there, or if you've seen things that are out there that are claiming to help cleanse out your colon. Well, let me tell you, the first thing I recommend is do not take a colon cleanse to cleanse your colon. That is literally what your colon is used for. It is the whole function of your colon is to get rid of waste and to get rid of debris. So you really don't need a lot of anything else to help do that, because it really is going to play no role and no purpose for you to do that. So don't get a colon cleanse. In fact, the ingredients in colon cleanses actually are not good for you. They have a lot of extra thyroid hormones, extra caffeine, and it can really jack up your GI tract. So first tip, don't take a colon cleanse. But there are some things naturally you can do to help out with your colon. First thing I recommend is fiber. Fiber supplementation is a foundation for gut health. It's a foundation for keeping your colon healthy and clean and to sweep everything through. And so take a fiber supplementation, whether it's fibrous foods like fruits and vegetables, or even supplemental fiber like benefiber or citrucel, which work fantastic. They're synthetic. You typically don't have long-term side effects or bloating from that. It's one thing I recommend. Number 2 is also make sure you hydrate as well. Hydration is critical when it comes to cleaning your colon as well. You need that water to help flush things out, to help flush things through, and to allow you to have better bowel habits. And number 3, there are some motility agents that are natural to help out with the contraction of your gut to allow things to go through. One thing I recommend is black coffee. Black coffee is a natural laxative that can allow you to help contract the colon, contract the gut, and cleanse out your colon. Kiwis also are a fantastic source of a natural way to help out with cleansing your colon. 3 to 4 kiwis per day have been shown in multiple clinical trials to help with the sweep of the colon and to push things through. And prune juice and prunes also are a very effective option to help out when it comes to cleaning out your colon and getting things through. So if you're wondering, hey, should I get a colon cleanse? Don't try a supplement to help out with that. Try the more natural options to get your colon taken care of, hopefully get you feeling better as well. Let me know in the comments down below if you've tried this, or if this worked, or if it hasn't worked as well. All right, perfect. Raymond, thank you for watching from Idaho. Ag Evermore, thank you for watching. Dawn, thank you for watching as well. All right, guys, we have another question coming up. Hey, Dr. Islam, I have gastroparesis. What are some treatment options for this? Let's discuss this in a little bit more detail. So what exactly is gastroparesis? This is delayed gastric emptying. One of the more common reasons is diabetes. Diabetes can affect everywhere in your body, including your GI tract, your stomach, your colon and your small intestine. When it affects the stomach, it leads to a condition called gastroparesis, or delayed gastric emptying. This is when your diabetes doesn't allow your stomach to contract fully, and so you feel like food is just stuck in your stomach all the time. It doesn't want to pass through. You have a lot of nausea and vomiting for that. What can you do? Well, first thing we recommend for anyone who has gastroparesis is to change their diet. You need to be on a small, frequent meal all throughout the day, like you're grazing all throughout the day. And this is one of the very uncommon reasons why I recommend to not take a fiber supplementation. Fiber has been shown to make gastroparesis symptoms worse. So don't do that. It's going to make things worse. It's making you more bloated, more distended, and not feeling very good. So try not to take any fiber supplementation. Go low in fat as well, because fat wants to sit in your stomach and not pass through as it's going through the GI tract. It's another thing you want to maybe not do as well. And then number 3, have small, frequent meals all throughout the day. Do not have the 3 big meals like you normally have. Your stomach cannot tolerate that. It doesn't feel good when you have it, and it needs just these small, frequent meals all throughout the day to help you to digest better and to allow you to allow things to pass through a lot easier. These are some natural options we recommend. If that doesn't work, we have some medical therapies that are out there that can help out with the motility of your gut, depending on the degree of gastroparesis that you have and your main symptoms as well. So if you have this condition, come see someone like me at Love Gastro. We can get that taken care of. We can evaluate, do you actually have gastroparesis, because it's a specific diagnosis that we need, and we can talk about what other treatment options we can offer for our patients as well. Let me know in the comments down below if you've tried different options for gastroparesis, what does work, what hasn't worked. I would love to hear what you guys have to say. All right. Good deal. Perfect. Well, if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. Typically, every Monday I go live, usually at 7 p.m., but we had a technical difficulty today where we couldn't do this. We're doing it 1 hour later. I'm a board-certified gastroenterologist trained at the Mayo Clinic, and if you have any GI issues, come see us at Love Gastro for all your GI needs. Don't forget to subscribe to my channel, like, share, and subscribe so you can get notifications of when I'm going on live. And let me know in the comments if you're watching this live or on the replay as well. I love to hear where my audience is coming from. And smash that like button. Give me some likes, give me some shares as well, so we can hopefully continue this out longer as well. All right. Question number 3. Hey, Dr. Islam, which magnesium is the best magnesium out there? Let me know in the comments down below if you're wondering if you should take a magnesium supplement, or if you're wondering which type of magnesium we should take or maybe not take as well. So in essence, there are 3 main types of magnesium. We have magnesium oxide, we have magnesium citrate, and then we have magnesium glycinate. Let's talk about all these 3 things. So magnesium oxide is one of the more common magnesium that's available out there, and it really tends to help out with sleep. For a lot of my patients that have sleep or anxiety, magnesium oxide can really help out with that. Also, magnesium oxide is the same magnesium that you use for Tums or Rolaids. Helps to kind of soothe the gut, to help calm things down in your upper GI tract, and help out with reflux, nausea, upset stomach, indigestion, things like that. And for some people, it can also be a small little laxative to allow things to pass through as well. So that is magnesium oxide. Next, we have magnesium citrate. Magnesium citrate is the one that we typically recommend when it comes to constipation. And this is one sometimes that we use for a bowel prep as well. So for my patients that are constipated or have lower GI issues, this may be a supplement that we recommend to get them regular, to get them feeling better, and to help out with constipation. The benefit about this magnesium as well, it's going to help to calm things down to allow you to sleep. So sometimes I recommend for patients to take this at night to help out with both sleep and constipation. This is the second magnesium we have out there. The third magnesium is magnesium glycinate. Now this is a magnesium that typically doesn't have a lot of GI benefits, but it does also help out with sleepiness, but also muscle relaxation as well. So sometimes some athletes will take this particular magnesium to help out with soreness of your muscles as well. So these are the 3 magnesium that are out there. Here's what I recommend. If you want to take a supplement like this, always make sure to speak to your healthcare provider about whether you would benefit from taking a magnesium supplement like this, because you don't want to take something that you may be taking too much of or maybe interacting with other medications you may be on. So don't start taking these supplements unless you actually get the benefit or the discussion with a healthcare provider so we can truly understand which magnesium is for you. And you can have that discussion about what we're trying to do, what we're trying to treat to hopefully get your symptoms taken care of as well. It really just depends on the individual. It depends on the symptoms, and also depends on their other medical problems as well. So just keep that in mind. I hope this was helpful for you when it comes to magnesium supplementation as well. All right, if you're joining for the first time, my name is Dr. Islam. Yes, I'm a board-certified gastroenterologist trained at the Mayo Clinic. Every Monday, typically at 7 p.m., I go live and answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Come see us, Love It Gastro, for all your GI needs. And let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. All right. Perfect. Oh, so gastro, so it's gastroparesis. Let me type it out for you, Gene. Gastroparesis. All right, perfect. All right. Perfect. Next question. It's a great question. I hear this all the time. Doc, my bottom is burning. I have burning diarrhea. What is the cause, and what can I do to get this taken care of? Let me know in the comments down below if you are one of those that unfortunately suffers from burning bottom, especially for having a bowel movement. It's a very common problem. Here are 5 reasons why your bottom may burn. All right, reason number 1, which I think you know, is spicy food. Spicy food can go all throughout your gut and cause irritation in your bottom. In fact, you have receptors in your bottom that are very similar to the receptors that can taste spicy foods in your mouth and in your upper GI tract as well. And these same receptors are there, and they can cause you to feel that burning sensation in your bottom. This is very common that we see here in West Texas because of the yummy Tex-Mex that we have here. People love their jalapenos, their chile, and food like that. And when you eat something spicy, it can come out spicy in the bottom as well. So that's one reason why you may have a spicy bottom. Number two is that you actually may be using too much toilet paper. Yes, I know, but toilet paper can irritate the bottom and cause that burning sensation to occur. Toilet paper can actually cause a lot of irritation, inflammation, and make it more likely for you to develop some sort of infection in your bottom to make your bottom very, very spicy. So keep that in mind. Maybe overuse the toilet paper or not wiping correctly can cause you to have a spicy bottom. That's reason number 2. Reason number 3, which we commonly see, are hemorrhoids. Hemorrhoids are dilated veins in the bottom that can cause pain, bleeding, itching, and pressure, and cause that dreaded spicy bottom as well. And there are a lot of ways that we can talk about getting rid of hemorrhoids, and which we'll talk about. But typically, getting rid of those hemorrhoids will eliminate that spicy bottom and prevent that problem from getting worse for you as well. Now, another thing is that sometimes some people get some food poisoning as well. If you ate something bad, or you're around people who are sick, or maybe you took antibiotics for too long, you can get a GI infection inside your gut that can cause a significant amount of diarrhea to occur and movement and change in your gut microbiome, which can cause the burning to occur down below. So having some sort of food poisoning or some infection can very commonly cause you to have a burning bottom down below. Then lastly, you may suffer from an actual GI disease causing your symptoms, whether it's irritable bowel syndrome, IBS, inflammatory bowel disease, Crohn's, colitis, anal fissures, things like that. These are very common symptoms and signs, or this is also a very common symptom sign of these conditions if you have burning diarrhea down below. And sometimes we need to do further investigation to find out exactly what is going on so we can get this taken care of you. All right, now that we talked about why you have a burning bottom, what can you do? What can you do to fix this? Here are my recommendations. So number 1, always start off with diet and lifestyle. So have a high fiber diet and add as much fiber as you can. Fiber is the backbone for gut health. It can help control those loose stools, control that diarrhea. If you can't take fibrous foods, maybe take a over-the-counter fiber supplementation like Benefiber or Citrusol, which work really good to allow you to bind up that stool to help out when it comes to burning problems going on as well. Number 2, try to actually have what's called a hell week when it comes to spicy food. I know it's crazy, but the more spicy food you have on a consistent basis, the more used to your bottom and your receptors are going to be to having that spicy food. For some of my patients who love spicy food, I tell them, go for a hell week, go crazy on spicy food, that actually may make your bottom more used to having it so you don't have many issues down below. Number 3, consider getting a bidet. I am a huge fan of a bidet. I think everyone everywhere should get a bidet. They're cheap. They're on Amazon. You use this to help clean your bottom. It prevents you from having any residual issues going on down below, and very commonly can help out with a spicy bottom, and very commonly can help out with the spicy bottom as well. Next, number 4, don't wear tight clothing. You need to let your bottom breathe. That tight clothing can cause wetness to occur, infection to occur, and make it more likely for you to have problems down below, especially a burning bottom. So try to have loose boxers, loose underwears, loose clothes to allow things to go freely. And then lastly, get your hemorrhoids fixed. This is probably the most common reason why people have an itchy bottom or a burning bottom. This is the most common reason why people have a burning bottom, are hemorrhoids. And once you've had symptoms from hemorrhoids, it's not a matter of if, it's a matter of when. When are they going to come back? And getting those hemorrhoids fixed, getting them resolved, and treating those hemorrhoids is going to be the best thing that you can do to prevent this from coming back. If you're wondering how can you fix them, come see us, Love a Gastro, where we have options to get rid of them, which is quick, easy, and painless. We can get you taken care of. So let me know in the comments down below if you have any other questions about the dreaded burning bottom and what you can do to get that taken care of, because I know a lot of my patients asking this question as well. All right, perfect. All right, so Lois asked a question about coenzyme Q10. So I'm not quite sure exactly what your question is on that, but let me know in the comments down below, Lois, what that is. So somebody's asking about coffee enemas. So let me talk to you about what is my thoughts on coffee enemas. So luckily, I have a video on my YouTube channel about this, so go to that video as well. But coffee enemas, I never recommend. There are so many complications that can occur with coffee enemas. They cause significant side effects for a lot of my patients. You are literally sticking coffee up your bottom. That is not natural, and there's so many problems that can occur with that. In fact, I've had to send patients to the emergency room because they actually tore a hole in their bottom from taking a coffee enema. Don't be like that. The evidence is not there. The evidence does not show that it works, and there's so many side effects with that. And so there are better things that we can do to help out with constipation. It does not stimulate the vagus nerve. It does not help out with bowel issues. Please do not use a coffee enema. The benefits are not there. I'm glad that question was asked. All right, guys. I think those are most of the questions, and I thank you for watching. Hopefully next week I'll go back at my normal time, 7 o'clock p.m. Central Standard Time. Well, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, where you can get great tips and tricks like you're watching in today's video. And come see us, Love a Gastro, where we can take care of all your GI needs. So thank you for watching. Have a great day. Look forward to seeing you guys on future videos. So thank you guys for watching. Appreciate it, and have a wonderful day.